Welcome back, dear viewers, and to shed light on the 100 Days of Health initiative, we are delighted to be joined over the phone by Dr. Islam Hanan, a health consultant. Good afternoon, Dr. Islam.
Good afternoon. Always a pleasure to be in my
Welcome to our program. We are glad to have you with
you.
us. Doctor, how do you see the achievements of the initiative 100 Days of Health?
So as the report was actually mentioning, the 100 Days of Health is very important because it's the big umbrella and overarching over the other initiatives that Egypt launched. So Egypt, since 2018 till now, launched 14 presidential initiatives for health. And the 100 days, it integrates all the presidential initiatives to be available for citizens in one place. The importance of having 100 days is previously to that, we do have, for example, the Women Health Initiative located in one place, and Children Health for obesity, for stunting, and anemia located in another place. Now citizens can go as a family and take all the services from one place, and hence you are actually integrating the services, and hence you are spreading more awareness and reaching more citizens for that. The idea of piggybacking is the main principle of public health initiative in general, because it will be a waste of resources if we do have different places for different initiatives. I believe the idea of the one family health and the 100 days of health is the most important and pivotal role this initiative is playing to support the one family concept, having all the initiatives for the whole family.
Dr. Islam, what are the most important diseases that can be tested through the 100 Days of Health initiative?
So to start with, we are talking about the non-communicable diseases and like diabetes, hypertension, and now we are adding obesity as well, which is a big concern and a precursor for a lot of non-communicable diseases as well. And we do have the cancer initiatives, which we are talking about 6 types of different cancers, starting with the breast cancer, liver cancer, colorectal cancer, and lung cancer, and as well as the prostate. And we do have as well for children the awareness regarding the stunting, obesity, and anemia initiatives, and which is very important because we are tackling children from school age, starting from 6 years old till 13 years old. And we do have as well the follow-up for the pregnant women for infectious diseases. So if you look at it, it's taking the life journey starting from women and health of the pregnant mothers, the 1,000 days starting birth till 6 years old, and school days till 13 years old, and then you do have the different initiatives or the non-communicable and cancer. So you are talking about 9 disease areas, different disease areas, that can be actually covered in the screening and early detection. Of course, there is 2 main pillars. The first is the diagnosis itself, and then if there is, unfortunately, a disease confirmed during diagnosis, he will be referred for treatment. Some of the presidential initiatives got the treatment arm as well, like the cancer initiative and women health initiative, and some, like the stunting and obesity, they are referred to the primary care unit, which got a different and standalone presidential initiative as well to take care of the treatment arm.
Dr. Islam, you are talking about diagnosis, but what about how does testing all these number of citizens, how does this help in taking preventive measures to save these citizens from these diseases?
So that's a very important question, and because you mentioned prevention, prevention is a key actually indicator for our vision in 2030. We moved since 2020 from the vision of just having a cure or treatment for diseases to having a new vision for preventive measures, to focusing on the person centricity rather than the patient centricity. And doing scans and diagnostics, it's only not for the targeted one, but also you can discover, for example, for breast cancer, you can discover other lumps, you can discover a lot of benign things, fibrosis, for example, that can be actually tackled. So having that, it adds to the idea of losing or lightening up the pressure on the treatment arm in the future. So just to tell you, for example, for breast cancer, if we took it as an example, because you are doing the breast cancer screening, you discovered around 30,000 breast cancer cases out of 30 million Egyptian female screens. And if you are not doing that, you would have discovered the cases in a very late stage. We are talking about stage 4, which is metastatic, which is fatal within 2 or 3 years. And because you are doing that, you are adding lives to the patients, you are adding more quality adjusted life years, And most important, you are even more efficient in terms of providing the service. And last but not least, economically, you are saving money because each Egyptian pound you are spending in the screening, you are returning back to the economy 1.65 Egyptian pounds. Thus, screening and prevention is better than treatment. It's already proven on the ground from economic perspective and, of course, from health perspective.
So although the state will benefit from such campaigns, not only the citizens. Dr. Islam, what are the areas covered by the second phase of the initiative?
So the second phase is always about the referral from the diagnosed cases to the treatment. So whenever we are talking about launching the first phase, it's a screening and diagnosing. And second phase, it's usually the referral for the diagnosed and the treatment itself. So you got many presidential initiatives already reached phase 2. We are talking about hepatitis C, for example. Currently, we are treating fully all hepatitis C positive cases and with a very good return on investment. For cancer initiatives as well, you launch a phase 2, which is reaching the treatment. And currently, the most important item is to unify the treatment protocols of the second arm. If you're going to be launching a second phase, it means that citizens can be reimbursed from the own state fund and can be reimbursed as well from the health insurance. So we need to unify these two umbrellas, insurance, and making sure that it will be a bridge with a new universal healthcare coverage, which is currently launched in 6 governed rates, and every year is taking more governed rates. So unifying protocol is one thing. Second, making sure that we have equal access for all individuals to the healthcare facilities.
Concerning the follow-up, doctor, are there any follow-ups on the cases of the first phase?
So that's another good question because, for example, if any person done the screening and we are suspecting, still there is nothing, but we are suspecting, we need to follow it up again. That happened, for example, in hepatitis C. That happened in the cancer initiatives. And if we take, for example, liver cancer initiative, if a citizen is actually in the diagnosis phase, and in the diagnosis he's high risk factor but not diagnosed with cancer, they must do the same test again after 1 year. The importance of the follow-up is to make sure that after 1 year for breast cancer, for liver cancer, for stunting and anemia, we are making sure we are not losing any case, which is, from scientific perspective and economic perspective, it's a very important one because once you are doing the screenings to a citizen and you are not following it up, the citizen will be relieved that, okay, I passed the screening test, so I don't have the disease, so he can continue like 5 or 6 years without screening. If we take it for stunting, for example, for school children and obesity and anemia, it's done for every year. For currently, this is the 5th year. So every year you are scanning for stunting, you are scanning for obesity, making sure that you are not missing any case, which if I'm saying that screening is important, follow-up is more important not to lose any case.
Dr. Islam Anan, thank you so much for being with us. Dear viewers, a short break and we'll be back again.